to both the health sector and the patients. She added that it was worthy of note and commendable that the donated items were locally produced in Nigeria by the defense industry, pointing out that people had looked inwards and used their initiative in this challenging period.
One of the bright spots in this otherwise dark pandemic has been that a lot of things have had to be looked for in our society. I've had to look inwards to produce things because the pandemic is all over the world. Everybody is minding its own business, as it were. And we have had to look here within ourselves in Nigeria to see what we can do to support ourselves. We have had to use Nigerian manpower to manage all the equipment that we're having to use.
Engineer Salako Ojedele added that the equipment being donated will be sent to health sector, especially the PPEs, for the healthcare practitioners who are on the front line of the battle to keep the patients well. According to her, a lot of policies had been put in place by the present administration to ensure that health workers received the best in terms of insurance policies and hazard allowances, as well as having right equipment to work with. She added that sensitization and enlightenment campaigns were ongoing at various markets in the state, with the provision of hand-washing facilities to keep the citizens safe. Earlier in his presentation, the Chief of Army Staff, Lieutenant General Tuko Buratai, who was represented by General Officer Commanding 81 Division in charge of Lagos and Ogun, Major General Joseph Irifin, pointed out that in a bid to support the state in its fight against the pandemic, the Nigerian Army has presented PPEs to support the state government, which included sanitizers and gloves, aprons, nose masks, and buckets, as well as other items that could help in the fight of COVID-19. The Ogun State government has reaffirmed its support to major practitioners in the state during and after the period of COVID-19 lockdown, relaxation, and the curfew imposed by the president in an effort to curtail the spread of coronavirus in the country. Special advisor to the state governor on media and communications, Honorable Remi Azan, stated this while reacting to continuous harassment of journalists whose operations extend beyond the start of the curfew at 8 in the evening. Peter Valomo has the details.
It is well known the world over the important role of media practitioners in the dissemination of information to people as well as happenings across the globe. One of those important periods is the current global coronavirus pandemic, during which journalists have had to work beyond expected hours. However, the case of continuous harassment of journalists who work late into the night has become worrisome, even when they produce a means of identification as directed by the federal government.
People are running away from all this COVID-19. The journalists will still go to isolation center without being a victim of that virus. Journalists will still go to so many dangerous zones.
From channels, from Ogtv, from this, even 11 o'clock, 12 o'clock, update on COVID, update on this, update on that. So if they are now leaving their office late in the night, 8, 9, 10, even 11, going home, I don't see why anybody should molest them.
Some media men who were delayed for hours on their way home at police checkpoints shared their experiences.
Someone who has been at work since morning and then closes at night is on his way home with a car, with his ID card, with everything that you need to actually certify that is actually a journalist or works with a reputable media organization that you know. I see no reason why you should hold such a person.
And on the long run, what I heard is it is strictly locked up for everyone. No to your pass, no to your ID card, and it was just, I got released around 12:45 a.m.
Aware of this situation, the Ogun State Police Public Relations Officer, DSP Abimbola Oyeyemi, reacts.
If you work late, you try as much as possible to stay back in your office. Wherever you are at 8 o'clock, meet you there, stay there. There are some journalists that can be excused on a very serious ground, and such person must be harmed with his identity card and the reason why he is out at that particular time.
Meanwhile, Special Advisor to the Ogun State Governor on Media and Communications, Honorable Remi Azan, who said he was just being informed about the matter, speaks on how the state government plans to wade into the matter.
My advice will be that broadcast organizations should arrange for their staff who work late night on moving together in groups so that it will reduce the burden of proving that you actually are a media practitioner to the barest minimum. If anybody has been malhandled, please, sorry, it could have been a break in communication gap. Please let us know more about such, and the needful will be done to correct whatever misinformation is there.
Media houses generally work late into the night, as late as 10 p.m., to put to bed news and programs production. This makes the issue very contentious and delicate to deal with, especially with the mutual relationship expected between this industry and security agencies during this COVID-19 period. Peter Falomo, Ogtv News.
Towards effective enforcement of the lockdown order by the Ogun State government, 102 violators were arrested and prosecuted by the mobile court in Abeokuta, the state capital. Ogtv News reports that the mobile court placed today at Ibarra roundabout, Abeokuta, was the effort of a combined team of different security groups. Once again, Peter Falomo has the details in this package.
In its day one of operation, the Ogun State Mobile Courts set up to prosecute violators of lockdown order and those who fail to wear nose masks, commercial motorcyclists and drivers who flout the order of approved passengers in transit were prosecuted. Officers of the Nigerian Police, the Nigerian Security and Civil Defense Corps, Traffic Compliance and Enforcement Corps, and officers of Vehicle Inspection Service pooled efforts with lawyers to prosecute violators. Head of Operations, Vehicle Inspection Service, Engineer Taufik Babalola, speaks on the arrests made.
We started this thing this morning here after the signing of the Infectious Disease Regulation Control being signed by His Excellency through the Commissioner of Health yesterday. That's why now we brought the mobile court down to this place, at least to effect the law being signed yesterday, to caution the people that violate the restriction law order by the state. And they have been arraigned before the magistrate court inside the mobile traffic court there.
Corps Commander, Traffic Compliance and Enforcement Agency, Commander Sheni Ogunyemi, also explains other criteria for arrests made.
We intercepted them at Yanomo Shuare, and definitely we saw the goods there, that is food items. But the numbers with the pepper, so much, they are about 14 or 15 there. If you are going with an essential goods, definitely you should not be more than 5 maximum, including the driver. But for security reason, 3. So 2 and the driver, that is 3. 2 to offload when you get to the market. You understand? So they are violated. And when you look at them, majority they are not using their face mask at the time we call them. You understand? But I can see 1 or 2 now quickly bringing it out to use it. We know that they are men, they are our women, but we still need to maintain sanity. That when you are going out, if you have a cause to go out, definitely you must use all face masks or nose masks.
Operations of the mobile courts continues during the period of the lockdown. Peter Falomo, Ogtv News.
And still on the lockdown order, the restriction order on interstate movement is part of measures put in place by governors across the 36 states of the country to prevent the spread of COVID-19 from one state to another. As the epicenter of the pandemic, the border between Ogun and Lagos has been receiving attention from both sides to prevent the spread of the virus. Matthew Shomi was at the boundary between Ogun and Lagos State in Baja and brought back this report.
On Monday, 4th of May, Lagos State entered the second phase of the battle against COVID-19 with the gradual opening of the state. But the lockdown still continues in Ogun State, while there is also restriction on interstate movements. A high volume of traffic is being recorded on both sides of the Baga end of the border between Ogun and Lagos States as vehicles wait in line to go through the barricade put in place by the security personnel to check the movements of the people. While some of the vehicles on the road are part of the people exempted from the restrictions, others who have no genuine reasons to be on the road are hiding under the exemption to move about freely. I'm standing now is the border between Ogun and Lagos States. Despite the restriction on interstate movements, we can observe that people are still moving from Ogun State to Lagos State, while some are moving from Lagos State to Ogun State. The situation is, however, different at Ojodu Abiodun side of the boundary between the two states, where a concrete barricade was erected to prevent movements. Where I'm standing now is a concrete barricade that has been put in place to check the movement of people from Lagos State to Ogun State, likewise from Ogun State to Lagos State. The essence of this barricade is to ensure that the directive on interstate movement by the Ogun State government is strictly adhered to. Our camera lens caught up with some of the measures put in place by Ifo local government in collaboration with members of commercial motorcyclists to properly check the cyclists and passengers at the boundary while complying with the guidelines.
We do a routine test of all Okada operators and Marual operators. We look at their temperature before they embark on whatever they intend to do in this, because here we share border. Down there is the border between Lagos and Ogun State. So there is no way we can stop the inflow. So because of the inflow, we have to follow strictly. So we just test them. Then we try to do this social distancing. Then we make sure that they don't take more than one passenger. While the Marua, they take just 2 passengers.
To carry one passenger, to use cover, to use nose cover, to wash your hand before you carry the passenger.
They praised the government for the efforts to curtail the spread of the virus. Matthew Shomi, Ogtv News.
Adamawa State has discharged its index case and 4 other COVID-19 patients from its isolation center after testing negative. State Governor Umaru Fintere, on his visit to the isolation center, described the recovery as a landmark achievement and a plus for the state. He said nobody gave the state a chance of being able to treat the index case of COVID-19 when it was announced, but with little or no support from the federal government, the state has succeeded in treating and discharging some of those who tested positive, while commending the health workers and journalists in the state for a job well done. The governor appealed to the federal government to consider the state on its list of support as accorded to other states. The release of the index case and 4 others became necessary after testing negative twice in line with NCDC protocols. The state government had on April 21, 2020 announced that a COVID-19 case was recorded in the state. Although all the close contacts of the index case have tested negative, however, other cases were recorded in various parts of the state. 17 people tested positive to the virus. 5 of them, among whom is a journalist, have been released. The World Health Organization says it met with 70 traditional medicine experts in a bid to find a cure for coronavirus pandemic. WHO African region made this known via its Twitter handle on Tuesday. The health organization said an agreement was reached with the herbal medicine experts on clinical trials of the remedies. The meeting is coming days after Madagascar said it found an herbal remedy capable of curing the disease. And still to come in the news, President Buhari seeks Senate's approval for 42 ambassadorial nominees. Join us in part 2 for details.
I no fit forget the day we all will life change forever.
It is now a reality. We will all face a global unprecedented crisis.
But even as we dey wrestle with this wahala wey brekete for this kind critical time, we don't promise ourselves say we go do better pass as we dey do before. And wetin we go do no be just for we o, na to see say we customer dem dey safe as we dey give them all the better things wey dem need pass for the price wey no go tear dem pocket. Because that na our work wey we must to do. We tanda gidigba for you all the time, and we go service you with joy and jollity every day.
Thanks so much for joining us once again. The federal government has warned Nigerians against the continued resort to recycling and sharing of face masks in the wake of the COVID-19 pandemic, saying such actions would only fuel more infections. The government equally tasked state government on the need to align their policies with those at the federal level, reminding them that the virus does not respect boundaries or status. It also added that the recent rapid diagnostic test kits procured by the Kogi state government have a high margin of error and are therefore unreliable. These were disclosed on Tuesday in Abuja during the daily briefing of the Presidential Task Force on COVID-19. Except for fabric mask, every disposable used mask is a hazardous medical waste and should be disposed of properly, preferably by burning. Ondo State has discharged 5 recovered COVID-19 patients from the infectious disease hospital in Akure after testing negative. This brings the total number of cases discharged in the state to 11. The Ondo State Commissioner for Information and Orientation, Donald Ojogo, disclosed this in a statement on Tuesday. Against this backdrop, only 4 active cases are currently being monitored in accordance with the globally accepted protocols at the infectious disease hospital. The Kaduna State Standing Committee on COVID-19 says 50 persons have been quarantined at the National Youth Service Corps NYSC camp for violating the ban of interstate travel in compliance with the quarantine orders of the state. This was disclosed in a statement on Tuesday by the Special Advisor to the Governor on Media and Communication, Muyiwa Adeleke. He noted that the arrested travelers will be isolated for 14 days to ensure that they are COVID-19 free. He added that with the exception of persons on essential duties, anybody attempting to enter Kaduna will henceforth be turned back and compelled to return to their point of departure. He, however, appealed to all Kaduna State residents to cooperate with the health officials whenever they are required to be tested for COVID-19, provide contact details, or to submit themselves for isolation and treatment if they test positive. President Muhammadu Buhari on Tuesday requested the Senate to approve 42 nominees as the country's ambassadors. The President of the Senate, Ahmed Lawan, read the President's letter as well as 2 other appointments into the board of the Law Reform Commission and Nigeria Deposit Insurance Corporation during plenary session. The ambassadorial nominees' request, which was contained in a letter dated May 6, 2020, reads, in accordance to Section 171, subsection 12C and subsection 4 of the 1999 Constitution of the Federal Republic of Nigeria as amended, I have the honor to forward for confirmation by the Senate the underlisted 42 names of nominees as career ambassadors designate. The ambassadors designate for confirmation are C.O. Nwachukwu Abia, A. Kafas Adamawa, R.U. Brown Akwa Ibom, G.A. Odudigbo Anambra, O.C. Onowu Anambra, Y.S. Leman Bauchi, and E.S. Agbana Bayelsa. Others are B.B.M. Okoyem, Bayelsa, GM Okoko, Benue, AM Garuba, Borno, ML Bashir, Borno, MO Abam, Cross River, AE Aloti, Cross Rivers, GE Edopa, Edo, and AN Madubuike, Enugu. The list also included Adamu, Lamoa Gombe, Mr. Innocent A. Lewijo, Imo, MS Abubakar Jigawa, YA Ahmed Jigawa, SD Umar Kaduna, A. Sule Kano, GY Amza Kano, N. Rimi Castina, LS Ahmed Rimawa Castina, M. Manu Kebi, LR Ocheni Kogi, LA Yusuf Kogi, M. Abdurrahman Kwara, Mrs. Y.A. Adedeji Lagos, and AU Oga Nasarawa. The career ambassadors designate also included A.A. Musa Niger, N.A. Kolo Niger, S.O. Olaniyon Ogun, A.R. Adejola Ogun, E. Awe Ondo, O. Aluko Oshun, I.A. Alatishe Oshun, V.A. Adeleke Oyo, N.S. Adamu Plateau, L.N. Charles Rivers, Z.M. Taraba, and B.B. Aman Yobe. President Muhammadu Buhari has asked the Senate to confirm Professor Jumai Audi as the chairman of the Nigerian Law Reform Commission. The Senate President Ahmad Lawan revealed this while reading a letter from the President to lawmakers present at Tuesday's plenary in the upper chamber of the National Assembly in Abuja. President Buhari also sought the confirmation of 3 other persons as regional commissioners of the agency. Similarly, President Buhari urged lawmakers to confirm 3 other nominees as non-executive directors of the Nigeria Deposit Insurance Corporation, NDIC. The House of Representatives has condemned the spate of extrajudicial killing and human rights abuses, especially by security operatives in the enforcement of the lockdown. At the plenary on Tuesday, the House especially resolved to condemn in its totality the abuse of the fundamental rights, especially brutalization and extortion, and the killing of innocent Nigerians by security operatives enforcing the COVID-19 lockdown across the country. The House requested President Muhammadu Buhari to direct heads of security agencies implicated in the human rights abuses and extrajudicial killings to immediately fish out the perpetrators for prosecution and punishment according to the law. Also, the House mandated committees with oversight over the security agencies implicated, including the House Committee on Human Rights, to investigate the abuses and killings. These resolutions were passed following the unanimous adoption of a motion moved by the Deputy Chief Whip, Mrs. Nkeruka Onyejiocha. The House further notes that besides the killings, security operatives have also physically assaulted and brutalized innocent Nigerians in the name of enforcing COVID-19 lockdown. Members of the House of Representatives have called on the federal government to intervene and immediately halt the repatriation of the Almajiri children to their states of origin. This formed part of the resolutions of the lawmakers during Tuesday's plenary at the lower chamber of the National Assembly in Abuja. They made the call following a motion sponsored by a member of the House, Aisha Duku. According to Duku, the repatriation of Almajiri children is against the fundamental human rights of any Nigerian to reside in any parts of the country. She also expressed concern over the mode of transportation the children were subjected to. The lawmaker described it as dehumanizing, stressing that the children were packed into a vehicle in the scorching sun. The House also resolved to urge the northern governors to ensure that the Almajiri children were captured in the universal basic and technical education system. On the occasion of International Day of Nurses and the 200th anniversary of the birth of Florence Nightingale, founder of modern nursing, Nigeria has joined the World Health Organization, WHO, among hundreds of partners to highlight the importance of nurses in the healthcare. The theme for this year's celebration is Nursing the World to Health. Ife Sholuade has details in this report presented from our studio.
Every 12th day of May marks the annual celebration of international nurses across the globe, as well as the remembrance of the founder of modern nursing, Florence Nightingale. The day has been sidelined to project the efforts of nurses as they provide high-quality treatment and care, being the first and sometimes the only health professionals that patients see.
Nursing is encompassing, and it is being practiced by a nurse. A nurse is an individual that is being trained in a recognized institution, either at the university or the school of nursing, and it is licensed to practice as a professional nurse after qualifying for the speculated exam. A nurse is the first person, so to say, to meet in an hospital. We are the first contacts. Before you meet anybody, you must see a nurse.
And as nurses account for more than half of all world's health workers, yet there is an urgent shortage of nurses worldwide, with 5.9 million nurses still needed, especially in low and middle income countries.
When we are talking about brain drain, nurses carry the bulk of the brain drain in this country because of the attitude of the public and the government to nursing and nurses. So we have good brain in nursing profession serving in various parts of the world. So they went out of the country because of the lackadaisical attitude of government to promoting nurses' welfare.
According to respondents, it is essential that government support and invest in nurses, particularly during this COVID-19 pandemic.
Challenges include inadequate manpower, inadequate equipment, infrastructural decadence, assault, harassment, and some other job hazards.
Not only in the hospital that you are working, and people see you as a nurse, they come to you even in your environment, in your immediate environment where you are living. They want to be educated on what and what that can promote longevity, or what and what can maintain good health. So governments should endeavor to recognize nurses and give them due recognition according to the world standard. Our public also should endeavor to recognize nurses.
By developing the nursing workforce, occupational safety, and providing enough facilities, countries can achieve the triple impact of improving health, promoting gender equality, and supporting economic growth.
With the novel coronavirus pandemic placing significant strains on the global health system, there is need for the federal government to facilitate easy access to primary health care centers, which is the nucleus of healthcare delivery system in the country. This was the view of some individuals who spoke with Ogtv News on the urgent need to strengthen the healthcare system in Nigeria in order to be able to manage the impact of the virus. Shemilori Amore has the details.
The COVID-19 pandemic since its outbreak has created unprecedented impact on global health. This has, however, raised concerns on its short-term implications and long-term consequences, which many believe will reshape health institutions in Nigeria. A member representing Yewa North State constituency and chairman, House Committee on Health in the Ogun State House of Assembly, Honorable Adeyanju Adegoke Awoso, and a medical practitioner, while speaking on the illegal movement of almajiris to the state, commend the trace call for intercepting the truck conveying the almajiris, describing the act as dangerous, especially during this critical period.
After we were saying that this pandemic, it is barbaric, it is unfortunate, it is better imagined than experienced, that Ogun State, that have not been nursing any almajiri, in the face of lockdown, expectedly, it is not supposed to be, at least before getting to Ogun State from Kano. If there are serious restrictions on this lockdown, I think they should not even get to Ota. before from Kanu to Ogun State. They do not even get water.
They also reiterate the need to maintain good hygiene and adherence to government and health institutions' directives on COVID-19.
It's when you are alive that you can think of future. It's when you are alive you can think of your business. There is only people that are alive that will structure economy. Someone under the ground cannot destroy economy. So we should be more after our life, our well-being, before we tell about, okay, my business and my plan for 2020. Nobody plan for this. So we should be more cautious of what is happening and to do the needful.
I have had opportunity to say it in many fora that COVID-19 has come to teach us some things. Whether we will now learn from what we are learning from COVID-19 and ensure that we continually keep the necessary things that we are supposed to do, we should learn from this pandemic. And ensure that they strengthen our healthcare system in terms of manpower, equipment, and of course, prompt attendance to patients. And of course, how do you strengthen healthcare system? You have to go to the primary healthcare center.
According to them, strengthening the healthcare system in the country will help frontline workers to cope with the crisis. Shemilore Amore, Ogtv News.
A former military administrator of Ogun State, Navy Commander Kayode Luke Olofimoyin, will on Wednesday, May 13, 2020, turn 70 years, born in Ilawe, Ekiti, in the present-day Ekiti Southwest local government in Ekiti State. Commander Olofimoyin was Ogun State military administrator between August 1998 and May 29, 1999, when he handed over to Aremo Olusegun Oshoba as Nigeria returns to democratic rule. The naval officer during his reign in Ogun State navigated through the nooks and crannies of the state, which culminated in an unprecedented achievement in rehabilitation and construction of roads, upgrading of schools and hospitals, as well as in the area of agriculture. As a sports lover, retired Commander Kayode Olofimoyin's unrelenting efforts to promote sports in diverse ways plummeted into the co-hosting of the first ever African Women's Football Championship with less than 10 days' notice. The success of the game played at the ultramodern MKO Abiola International Stadium, Abeokuta, was a testimony to the administrative and organizational ability of the former Chief of Naval Officer of ECOMOG in Liberia. Married to Olaibi Yimika Olofimoyin on 24th of January 1976, they both built a family and home filled with love and care, and the marriage is blessed with 5 sons. The police have rescued 2 women from suspected bandits in Kurti local government area of Katsina State. The police public relations officer in Katsina, Gambo Isa, confirmed this in a statement. He explained that the rescue operation was carried out following a distress call they received on Thursday last week. The bandits, numbering about 10 and armed with AK-47 rifles, were said to have stormed Sabonlai village on motorbikes and kidnapped some women. According to Isa, the police rescuing team succeeded in rescuing the duo of Uraira Monai 60 and Adiza Monai 50. Gunmen have killed 15 people at Gonun Rogo village in Kajuru local government area of Kaduna State. 5 persons were injured during the attack, which occurred on Monday night. The gunmen were said to have stormed the village while the residents had gone to bed and started shooting sporadically at their houses. According to the chairman of Kajuru local government, Kafra Kaino, the assailants shot 15 of the villagers to death in the process, while 5 others sustained various injuries. On business news segment, 11 power plant sulfur gas shortage. More on the business news segment after the break. On business segment of the news, the nation's biggest power plant, Egbi, and 10 others saw their output levels reduced by gas constraints on Monday. The other plants were Omotosho, Olorunshogo, Delta, Gerigutu, Sapele 2, Olorunshogo 2, Omotosho 2, Ihobo 2, Okpai IPP and Trans Amadi IPP. The nation's 27 plants generated a total of 3,000